I'll be honest, this Senate hearing on prescription drug prices was anything but business as usual. Senator John Kennedy didn't mince words. He went straight for the jugular, asking, why don't we skip the foreplay and go right to the sex? Blunt, sure, but it cut through the usual Washington fog, bringing a critical question into the spotlight. Why haven't lawmakers finally cracked down on pharmacy benefit managers, or PBMs? Let me break down exactly why this moment matters. PBMs are middlemen, companies that negotiate drug prices between insurers, manufacturers, and pharmacies. Sounds simple, right? Not exactly. Here's the kicker. Just 3 companies control about 80% of the PBM market, and these giants aren't just PBMs, they're tied up with insurance companies and even own their own pharmacy chains. That's called vertical integration. Imagine referees owning the teams they're supposed to keep in check. During the hearing, Professor Sood laid out the numbers. This dominance means less competition and, ultimately, higher prices for you and me, especially when it comes to Medicare Part D premiums. It's not just theory. Real-world data shows the more these companies control, the more Americans pay at the pharmacy counter.
Thank you, Senator Cohen. Senator Kennedy.
Professor Sood, as I understand it, 80% of the PBM market is controlled by 3 companies, 3 PBMs, that are vertically integrated. Is that right?
That is correct.
Does your research show that the prices that consumers pay are higher than they would be if those companies were not vertically integrated?
So my research on Medicare Part D...
Give me an answer.
Partially.
What do you mean partially? They're either higher or they're lower. There's no such thing as a partial price.
What I find is that Medicare Part D premiums are higher as a result of vertical integration.
Okay. Well, then why don't we, I'm all for transparency, Mr. Chairman, I want to say that. But why don't we skip the foreplay and go right to the sex and outlaw vertical integration for Part D? Would you accept an amendment to your bill like that?
I don't want to answer that question right now because I want to study that.
Would you support that, Mr. Scott? Let me just guess what your answer is.
No, sir, and I can explain why.
No, you speak Sanskrit. I mean, I'm sorry. You know, you're good at it, and I know your job is to protect PBMs. And I'm like Tillis, I don't think PBMs are the only ones at fault. But you don't have unclean hands. Professor Sood, you say PBMs ought to be fiduciaries. To whom?
To both the plan and their members.
Well, what if the plan and the members' interests diverge? Who are they fiduciaries to?
Ultimately, in principle, they should be fiduciaries to the members.
Okay.
So, for example, ERISA makes...
I get it.
Okay.
I get it. Mr. Chairman, again, why don't we skip the foreplay and go right to the sex? Why don't we just amend your bill to require that PBMs have a fiduciary obligation to plan members?
Well, I think that's been suggested, and I think there's part of that in our legislation, but probably not fully enough to satisfy you.
Well,
so let me look at what you want to add to it.
Okay. I mean, I'm not criticizing your bill. I don't want my office to end up in Bethesda. So I'm not criticizing your bill. I like transparency. But we're just nibbling around the edges here. And with respect, Mr. Scott, your definition of a fiduciary is wrong. A fiduciary isn't somebody that controls the decision. You know that, and I know that. A fiduciary is somebody who has a legal obligation to give his client the best advice and to do what's best for his client. It doesn't replace agent with principal or vice versa. You know that, and I know that. Well, you need to talk to your lawyers. I may be wrong, but I doubt it. Let me go back to Professor Sood. Tell me 2 things you would do tomorrow to fix PBMs and result in lower prices for consumers?
So I think the two things I would do is...
Very specific.
Yes. I would implement price transparency so that everyone knows what they're paying. And
Okay, price transparency just tells us who's screwing them.
Yeah.
Okay.
And then the fiduciary responsibility says, if you're getting screwed, I can take you to court. So I would do those two things. And those are, I think, better than banning particular practices, because otherwise it's whack-a-mole. You ban spread pricing and something else will show up a year from now.
I got 29 seconds. Do you have any other suggestions? I appreciate your
So
straight talk.
the other thing we can do is, what I recommended is pass-through of rebates to patients. So suppose a drug...
Say that again?
So pass-through of rebates to patients. So for example, the list price of a drug is $50,000. But the rebate on the drug is $40,000. So when a patient is paying cost sharing, suppose 10%, they should be paying on the post-rebate price, so which is the $50,000 less the $40,000 rebate. Right now, what's happening is patients are paying cost sharing on the $50,000. So this would immediately lower patient out-of-pocket costs. So as Dr. Kircher said, for the cancer patients.
So you're saying the number after us, the PBMs are jacking up, are encouraging manufacturers to jack up the list price so they can jack up their rebates.
And that
is that right?
Yes.
That's illegal.
And the jacked up.
That's illegal.
Yes. I don't know about that, but it.
I do.
Okay.
It's illegal as hell.
Yeah.
Before I call on Senator Ronald, want to remind my members we got a vote and they're enforcing the 30-minute rule. So
Senator Kennedy wasn't having any of the usual slow walk. Instead of tinkering with minor regulations, he said, why not go big? Outlaw vertical integration for PBMs in Medicare Part D. That's a radical idea. But when witnesses hesitated to back it, Kennedy called out Congress for nibbling around the edges and protecting industry interests over people. Suddenly, it wasn't just a technical debate. It was a gut check. Are lawmakers serious about real reform, or just maintaining the status quo? From there, the conversation zeroed in on accountability. Kennedy pushed, shouldn't PBMs have a fiduciary duty? A legal requirement to put patients' interests first. Professor Sudd agreed, at least in theory, but Kennedy argued the current system lets PBMs dodge that responsibility, influencing prices while dodging blame. So who are PBMs really working for? Patients or profit? Solutions came into focus. Professor Sudd pitched two big changes. 1, full price transparency throughout the drug supply chain, and 2, enforce those fiduciary duties, so PBMs are legally on the hook if patients get hurt financially. The boldest idea? Send drug rebates directly to patients. Instead of paying copays based on high sticker prices, patients could finally benefit from the discounts PBMs negotiate. Meaning, real savings at the pharmacy. If you like clear, honest breakdowns of major policy debates, make sure you hit that subscribe button now. Stay informed as these issues play out in Washington. As the hearing ended, Kennedy's frustration was clear. Transparency helps, he said, but it won't fix a system built on conflicting incentives and rising list prices. The real question now, will Congress go beyond minor tweaks and actually confront the root causes driving high drug costs? This hearing wasn't just about technicalities, it was a rare, unscripted look at who benefits from the current system and who pays the price. These arguments over PBMs, rebates, and accountability could shape the future of healthcare and decide what millions of Americans pay at the pharmacy counter. Thanks for watching, and keep your eyes on what's next.